Welcome to Community Connection. I'm your host, Martha Konstandinidis. Today we'll be discussing the topic of Medicare and getting into details on what you should know before the annual enrollment period. With me today to discuss this is Blue Cross Blue Shield Massachusetts spokesperson and senior plan consultant, Heather Hurd. Thanks for joining me today, Heather.
Thanks, Martha.
So getting into it, could you just first explain to me what Medicare is for those who may not know or are just starting to get into Medicare?
Absolutely. So Medicare is federal health insurance. It's available to people age 65 and older and certain people with disabilities. And Medicare has been around since 1965.
So do you have to enroll for Medicare, and how does a person go about enrolling?
That's a great question. So when people reach age 65, or if they've been covered due to disability for 2 years, they may be entitled to Medicare benefits. They're going to enroll through Social Security. Now, if people are entitled to Medicare because they're 65, but if they're still working at an employer, they don't have to enroll onto Medicare. They can keep their employer coverage as long as that employer has 20 employees or more. But if they stop working, or if their employer is smaller than 20, they would want to enroll onto Medicare. And you do that with Social Security.
Okay, so I know you said that usually Medicare patients are 65 years or older, they have certain disabilities. So what are some other requirements, or are there other requirements that a person must meet if they get rejected after enrolling for Medicare?
Well, people usually aren't rejected because the criteria for being eligible is either you're 65 and older, or you may be younger, but you've been covered for disability for 2 years, or on the 25th month you could have Medicare benefits. So someone who's, for example, 40 doesn't go to Medicare or Social Security to sign up for Medicare unless they've been covered for disability. So you don't really get rejected. There may be instances where people have not paid enough quarters. People have to work for 10 years or 40 quarters and pay Medicare taxes as well. So if they haven't, they might have to work longer to be eligible for Medicare.
Okay, so for those who are enrolling in Medicare, what are some specific steps that people should take before enrolling in Medicare?
Okay, so we recommend at Blue Cross and Blue Shield that when people they're approaching Medicare eligibility, which is typically age 65, most of the people we see, that they contact Social Security Administration 3 months before the month of their 65th birthday. So everything with Medicare starts on the first of their birthday month. So let's say someone is born today, I believe it's July 6th today, their Medicare was effective July 1st. It's always retroactive to the 1st. Unless they're born on the 1st. If they're born July 1st, it goes back to June 1st. But 3 months before their birthday month, they can contact Social Security and say that they want to enroll onto Medicare. They can go on Social Security's website, they can call an 800 number, and many people still like to go to a Social Security office and sit down with a representative.
Okay, so that would be the best way. Is there any options online that they could go through, or is the best?
Yes, they can go on to ssa.gov, which is Social Security's website, www.ssa.gov.
Okay, so I know you talked about this a little bit just a few minutes ago, but do you need to have additional health insurance for Medicare?
Well, that is a good question, and we can talk for quite a bit on this now, because Medicare was begun. It was enacted by Congress in 1965. I believe the first Medicare beneficiary was eligible on January 1 of 1966. Original Medicare is made up of 2 parts, Part A and Part B. Part A pays for inpatient coverage, Part B pays for doctor care and outpatient coverage. But original Medicare was never meant to provide 100% comprehensive coverage. It was meant to provide people with core benefits. So Medicare leaves people with out-of-pocket cost sharing, some deductibles, and co-insurance. And it doesn't pay for prescriptions that we pick up at the local pharmacy, and it doesn't pay for some preventive services that people are used to having covered through their employer plan. So this is to your question, do people need to have other insurance? It's up to them. It's a personal decision, but I would say most people decide they do need to have other insurance. And there are various ways there's really two ways in our market here to get other Medicare plans. And there's different types of plans.
Okay, so you mentioned that there's Part A and Part B. So what are the differences between those, and how does someone know which one to pick?
Well, original Medicare is Part A and Part B. So they really shouldn't just pick that. Part A is paying for inpatient coverage. So when someone is in a facility, think of a hospital room and board stay or a skilled nursing facility for rehabilitative care, that's covered by Medicare Part A. And that is premium free for most people. They've worked, they've paid taxes, or perhaps they are a dependent spouse and their spouse has paid those Medicare taxes. They become entitled to Part A, and that is free. Part B is paying for everything that they have done on an outpatient basis and with doctors. So you can think of, a doctor's office visit, a specialist visit, and then all these outpatient services that we have today, like labs, x-rays, physical therapy, MRIs, even an outpatient surgery or an ambulance ride. All of this is covered by Medicare Part B. Now, Part B is not free. People need to enroll in Part B, and there's a standard individual premium everyone pays to Medicare for Part B, and that standard premium is set by the federal government, and it changes every year. This year, the Part B monthly premium is $164.90 per person per month. So people enroll onto original Medicare. A is usually free, B they're paying $164.90. And then they have inpatient and doctor care and outpatient coverage. How they pay that Part B premium, if they're collecting Social Security, it will be deducted from their check. If they enroll onto Medicare before they start collecting Social Security, Medicare is going to bill them for that Part B premium.
Okay, so since you do have to pay for Part B, when you're enrolling for Part A and B, is there a separate enrollment process for Part B, or would you just enroll for both?
Well, some people enroll in Part A before Part B. The reason that when we see that happen, that's usually because someone is still working beyond age 65 and they have an active employer plan from their company that has 20 employees or more. So they're going to keep that employer insurance, and they can delay Part B and not pay the monthly premium because they have that employer coverage. Sometimes people sign up for Part A because it's free, so they have Part A first, and then when they stop working, they go back to Social Security and they enroll in Medicare Part B. So everything's happening through Social Security. Sometimes people do not take Part A first and add Part B later. They'll just delay going on to Medicare altogether until they stop working. And if they retire at 65 and they let go of that employer plan, they're going to take A and B together all at once. And that enrollment is through Social Security.
Okay, so it's all through Social Security.
All through Social Security.
Okay, so you mentioned a little bit earlier that Part A and B wouldn't cover things such as prescriptions. So is there an option for patients if they are looking for prescription coverage?
Yes. So original Medicare is providing those health benefits, inpatient and outpatient, but not some preventive services and not outpatient prescription drugs. When I say outpatient prescription drugs, what I mean by that is these are the prescriptions where the doctor writes something and hands it to you, and you have to go down to your local pharmacy. You need to buy what's called a Medicare Part D plan. That's a prescription drug plan offered by a private insurance company that's contracted with Medicare. Another way to get those Part D benefits is to have a Medicare Advantage plan that includes Medicare Part D drug coverage. So Part D is the way that Medicare beneficiaries are able to obtain outpatient prescription drug coverage. Now, if someone's in a hospital, in a facility, and being given medications, those are usually covered by Original Medicare. Also, sometimes people need to go have medications administered, for example, chemotherapy or infusions. That may be covered by Original Medicare. So the outpatient drugs are really the ones that we pick up at the local pharmacy.
Okay. So you mentioned Original Medicare and then Medicare Advantage. So can you just tell me what the difference between those two are?
Sure. So the starting point is for people to have Original Medicare, A and B, from the federal government. And then if people decide they want to buy more coverage, so they don't have the out-of-pocket costs of Medicare, which are deductibles. There's a $1,600 inpatient hospital deductible this year. There's a deductible for Part B services, and then 20% after that. So some people decide, I don't like that out-of-pocket cost. They usually look to buying other Medicare plans. And where we live in this part of the country, in our market, there are really two ways you can buy other plans. One way is to buy something called a Medicare supplement. That's a plan that picks up Medicare's balances from A and B. You still don't have drug coverage, so you'd have to buy a Medicare Part D prescription drug plan. So this is very common. We see this a lot. People have Medicare, they have a supplement, and they have a Part D drug plan. These people have 3 insurance cards in their wallet. I like to call that the a la carte way of doing things. And they're paying 3 premiums. They're paying Part B to Medicare, they're paying a premium for their supplement to a private insurance carrier, and they're paying a Part D premium to a private insurance carrier. Other people will buy a Medicare Advantage plan, and these plans they're being very heavily advertised and marketed. They're gaining a lot of more interest, I think, and a lot of people are gravitating towards these types of plans. A Medicare Advantage plan is a way to obtain your Medicare benefits through a private insurance company. So you buy a Medicare Advantage plan from a private insurance company, and that insurance company is contracted with Medicare. And the insurance company receives federal funding for every member. They may charge a premium, they may not. There are quite a few low cost or zero premium plans in the market this year. The Advantage plan is going to give all of the Medicare A and B benefits, include the Part D drug coverage usually, and provide a lot of extra benefits that tend to be preventive type of benefits. So the 3 supplement, the supplement Part D, or the all-in-one Medicare Advantage plan where you're showing one card wherever you go. This is what we really see in Massachusetts.
And that would kind of help patients avoid the extra costs of 3 plans as well, right? Or would you have to pay still 3 separate costs for Medicare?
You do save a premium, good point. You still have to pay Part B to Medicare. Mm-hmm. You have to have Medicare A and B to be eligible to buy an Advantage plan. And you need to live in that plan's service area where it's sold. Then you may have a premium for that Advantage plan. These are usually under $100 or less. They're pretty well priced, and there are quite a few zero premium plans in the market, so no premium. And you save a premium if that plan includes Part D drug coverage. You're not paying an extra premium for the drug plan. So yes, you are saving a premium. With Advantage plans, you pay as you use services. So that's one thing people have to think about. Don't just focus on the premium. You're going to pay cost sharing along the way. Mm-hmm. So when you are on these plans, you'll have co-payments. They're structured more like your employer plan. So they'll have an office visit co-payment, a specialist co-payment, money towards hospitalization. So members should really pay attention, not just to that premium, but how much is the cost sharing, mm-hmm. because it can add up to something called an out-of-pocket maximum. And people want to know that amount because they're exposed to that amount of cost sharing.
Okay, so the out-of-pocket maximum would mean that whatever after that they would have to basically pay, or what does that mean?
No, so it's not like a deductible. I get that question a lot at our Blue Cross seminars. Is that a deductible? Do I have to pay that? It's not a given. People don't have to pay the out-of-pocket max, but what I like to call it is a potential. It's how much your cost sharing could possibly add up to if you had a lot of services. So on a Medicare Advantage plan, the typical out-of-pocket maximums in our area are between about $3,000 and $7,000 in a calendar year. The lower the premium, let's say you go for a zero premium plan, you're going to be in that higher range of $6,000 or $7,000 out-of-pocket max. Okay. Now, if you're someone who has 10 doctor visits a year and your copays are $20, you've paid $200 at the end of the year. That's how much your healthcare services cost. Yeah. But if you're someone who had a lot of services, a very unforeseen medical year, your out-of-pocket can accumulate up to that cap, that out-of-pocket max. Now, once you hit that cap, if you do, you don't pay anything more for the rest of the year on your Medicare A and B covered services. Okay. The Part D drug coverage cost sharing is usually not factored into that out-of-pocket max.
Okay. Does the Part D have its own out-of-pocket max, or?
It does.
It does? Okay. All right. So I'm just going to switch gears a little bit here. So what kind of services does Medicare not cover?
So Medicare, so when people go on to Medicare, in the first 12 months of being on Medicare, they have covered a complete annual physical. After being on Medicare for a year or more, Medicare no longer covers that complete annual physical year after year. They cover something called a yearly wellness visit, which is more of a meeting or a conversation with your doctor. So Medicare doesn't cover as many preventive services as our employer plans do. So it doesn't cover the head-to-toe complete annual physical year after year. It doesn't cover routine eye exams, where you read that eye chart to see if you need a stronger prescription. It doesn't cover routine hearing exams, which is a baseline preventive hearing test. It doesn't cover preventive dental services, money towards glasses, hearing aids. So really it's on the preventive side of things that Medicare is not quite there yet.
Okay. So why is now an important time to really know and learn about Medicare plans?
Well, people are aging onto Medicare all the time. And I would say a good time to really start learning about Medicare and the plans is about 6 months before you need Medicare. And the reason I say this is Medicare is complicated. You need to do some reading. It's a good idea to educate yourself on Medicare's website. You can even go to the various carriers who offer information sessions. I work at Blue Cross and Blue Shield of Massachusetts, and we have a whole team of people called the Field Outreach Medicare team. We do webinars and hotel seminars educating people about our plans. So about 6 months ahead of time is a good time to learn about Medicare, because if you wait too long when you have to make decisions, it's kind of stressful. For the people already on Medicare, summer is a good time to really think about what you want to do in the fall. The fall is the annual enrollment period. Every single year, people on Medicare can make changes to their plans between October 15th and December 7th for a January 1 effective date. So you may be on a plan that you're very happy with, but somewhere around the end of September or October 1, your plan is going to write to you and say, "Dear member, here's how your plan is changing for the upcoming year." It's really important that you open that piece of mail and you read the letter, because if your plan tells you, "Oh, we're making these little changes to your plan," and you're fine with that, you're on easy street. You can just, keep going and everything rolls over to the next year. But if your plan writes to you and says, we're increasing your premium, or your prescription's coming off the formulary, or something that you're not happy with, you want to pay attention to that, because you now have October 15th to December 7th to look around at other plans and see if there's another option for you that will take effect on January 1. So think about things over the summer. You won't know about new plans for 2024 until October 1, and those are Medicare regulations. Plans cannot release that information until October 1.
Okay, so as people are kind of waiting for the annual enrollment period, what are some good ways for people to actually prepare for it?
Well, I think good old-fashioned word of mouth is still a great way to learn about things. As you socialize with your friends, ask them what plan they're on. Ask them if they like their plan, what they don't like about their plan. You can also see a local Shine counselor. We have a wonderful program in Massachusetts. It's called the Shine program. And there are Shine counselors at senior centers throughout the state. You can usually make an appointment with Shine. There's also an 800 number you can call. It's under the Office of Elder Affairs in Massachusetts. And a Shine counselor gets special training to learn about all of the various Medicare plans. And they can help you with decisions that you're trying to make. There's another person who can weigh in and they're completely neutral. SHINE is actually an acronym. It stands for Serving Health Information Needs of Everyone on Medicare. So we call it SHINE because that's a lot easier.
Yeah, absolutely. Braintree has a Department of Elder Services. I'm sure where we have a SHINE counselor, I'm sure as well.
I'm sure you do at the local senior center.
Yeah.
And they may have limited office hours. Some senior centers have more than one SHINE counselor.
Okay.
A lot of them are volunteers, which is why the office hours could be limited.
Okay, so what are some new things with the Medicare plans this year?
Well, I can say something that's new with Medicare this year, which was really helpful. Last fall, Congress passed the Inflation Reduction Act, and in that law, it made some changes to healthcare costs for people on Medicare, and the most important thing it did is it limited the cost of insulin to $35 copays. So there are over 3 million people on Medicare who take insulin, and insulin was becoming very unaffordable for a lot of people. So this law that was passed took effect on January 1 of 2023, and it capped the cost of insulin at $35 copays. So the insulins that a certain plan covered on their formulary, it capped it at $35, making insulin affordable for the people who need it. So that was really new for 2023. In terms of the plans, I mentioned that the marketing on the Medicare Advantage has really stepped up. Mm-hmm. So people see actors on TV like William Shatner and Jimmy Walker.
Of course, Joe Namath.
Joe Namath, and they're talking about how they pay zero for everything. They're talking about the Medicare Advantage plans. Mm-hmm. So every year people really need to take a look at the plans that are out there and see what would meet their needs.
Okay, so if patients are traveling out of the country, are they still able to use their Medicare?
They are not. Medicare does not cover people outside of the United States. Now, the Medicare supplements, two of them will add in worldwide coverage. Usually that works on a reimbursement where people pay the foreign provider, they bring the paperwork back, and then they contact their insurance company when they get home to be reimbursed. Mm-hmm. The Medicare Advantage plans usually offer emergency worldwide coverage, but it's the same, a pay and get reimbursed. A lot of time people who are traveling will buy travel medical coverage for a trip to have more peace of mind and know the billing happens directly. And those plans usually pay for things like medical evacuation.
Okay. We only have a couple of minutes left. I do have a few more questions for you. I just wanted to ask, so what is the best piece of advice that you have for individuals who may be facing Medicare decisions this year?
Start early, do some reading, attend some seminars. If people came to our Blue Cross and Blue Shield seminars, they are called sales seminars. but you can just come in and learn and have a cup of coffee, and we'll tell you how supplements work, we'll tell you how Part D drug plans work, we'll tell you how our Medicare Advantage plans work. Part D is something that is very sophisticated. People should pay attention to how Part D drug plans work. And there are many plans in the market. So for people taking prescriptions, this is something they want to focus on. The Part D plans available cover medications, but we all use our own drug formularies. So you want to look at the various plans and see which ones cover your medications. This is how Shine can be very helpful. Also, Part D, when you're on Medicare, is not an unlimited drug coverage plan. It covers an upfront, it's called initial coverage. It covers an upfront amount of drugs. This year it's $4,660 in drug coverage. 2024 it'll probably be higher, but that's the amount of coverage people have in a whole year to pay for their prescriptions. And then they're paying with discounts out of pocket, and there's always catastrophic protection.
Okay, so what are some ways that people can either contact you or a representative so they can ask questions about Medicare?
Sure. Well, our Blue Cross website is an easy one. It's www.bluecrossma.org. That's our homepage. If you click on Medicare, all of our plan information is there. If you click on Attend a Seminar, you'd see all of our hotel seminars and our online webinars. Also, I would recommend people looking on Medicare.gov, Medicare's website, for information about general Medicare. Of course, the local senior center is a wonderful resource for people. So there are ways to get a lot of information right from your home.
All right, thank you so much. That's all the time we have today.
Thank you, Martha.
Thank you for joining us and teaching me about the world of Medicare today. And thank you for watching Community Connection. I'm Martha Konstandinidis, and we'll see you next time.